This short video is on the rehabilitation of shin splints. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then we suggest you skip the short theory section at the beginning and go straight to the rehabilitation exercises. Hi Sophie. Today we're going to cover shin splints. It's quite a common condition, and I'm sure you come across it with some of your clients at the gyms.
So what exactly is shin splints?
Shin splints is basically a kind of tendinopathy, an inflammatory condition which affects the attachment of particularly one muscle, tibialis anterior, onto the front of the tibia all the way down, and it becomes inflamed, tender, and quite a painful condition.
And what are the main symptoms?
The main symptoms can start with sensations like stabbing, burning, throbbing sensation, quite painful when you're doing activities in the gym, for instance, running or jumping. Then it can also be painful at rest. It can be kind of a burning background ache, even when you're resting. Sometimes it is also referred to as Medial Tibial Stress Syndrome. We're going to start with the very easy stuff like stretching, and as we progress through the rehabilitation program, we're going to move on to the more strengthening, the more engaging exercises. So some of the most simple exercise is to stretch the front of the leg, the quadriceps, and down to the foot by having your foot on the stool or on a chair, and then you're going to stand. That's it. If your ankle is sensitive or painful, you can position that a little bit further back. But if your ankle is fine, then have it at the edge. So what I want you to do is to bend that knee slightly, therefore increase the tension on the front of the lower leg, the tibia, and also the quadriceps. At the same time, of course, you are engaging the quadriceps on the other side. So you are strengthening that leg and you are stretching this leg. So how is that? Can you manage that?
Yeah.
Pause, hold it, maybe count to 3 or 5, depending on your progress, and then come back up again, relax, take a good breath, and then lower down again. If your balance is a bit shaky and you need support, by all means have a chair to hold onto or another surface area. But if you can do it without support, even better. Thank you. The next exercise is having one leg backwards whilst you are sitting on the chair, stretching again the front of the tibia. So, yeah. And as you progress with the stretch, you can put it a bit further back depending on your flexibility. Okay, how is that? Do you feel the stretch at the front of the leg?
Absolutely. Yeah.
Okay, you just basically stay there for, say, count to 10, relax, and then repeat the process again. Good, thank you. Sophie, the next exercise is basically kneeling with both knees on the floor, provided you haven't got a knee problem, because you have to flex your knees to their full extent, and you haven't got an ankle problem either. So basically kneel down on both knees and have your feet backwards and have your feet like that. Excellent. Are your knees okay like that?
Yeah.
Okay. To increase the tension, sometimes you can do a bit of a tilt backwards. Hold on to that. And then relax further forward. And then again, tilt backwards, support yourself, and go forward. Okay. How is that for you?
Yeah, definitely.
Good. Thank you. Okay. The next one is one of the classic quadricep stretches that you may have seen people doing in the gym. It involves you lying on your side on the floor, bringing one leg back and pulling it backwards so that we can stretch the quadriceps muscle. Yeah. So let's have you on your side. We're going to do both sides. Yeah. Okay. So grab the. You can either do the bottom leg or the top leg. It doesn't really matter. That's one variation. Now, if the ankle is sensitive, then you may want to hold it at the ankle, yeah, and gently pull it back, yeah. So we are stretching that quadriceps there as well, but let's try and do it the other way around. Let's try and stretch at the top leg. That's it, yeah. So gradually bring it backwards, yeah. What I don't want you to do is to extend your lumbar spine by over pulling that leg backwards. So to avoid that, you need to bend the bottom leg quite a bit, even more. That's it. By bending that leg, you keep the pelvis steady. So pull it backwards for me, hold it, count to 5, and then forward. Let's demonstrate that facing the wall so that we can get the perspective. And gently pull it backwards, allow the muscle to relax, and then take it a bit further, and just repeat it a number of times. Yeah. The next stretching exercise for the front of the tibia, for the tibialis anterior muscle, is to plantar flex the foot as much as possible, because what that muscle does, it does the opposite. It does dorsiflexion. It pulls the foot upwards. So we want to do the opposite. So how do we stretch it? We just basically put your toes facing backwards as much as possible. Excellent. And keep the pressure on that. You can bend a little bit with the other legs to increase the tension, depending on your tolerance. Now, if you have problems with your ankles, again, this may be very uncomfortable, or if you have a problem with your toes. So you may want to put a towel on the floors to soften the contact. And once more. Lovely, thank you. Okay, so far we've been focusing in stretching the affected area, which is basically the front of the shin, the tibialis muscle, and so forth. But when we're rehabilitating someone, we don't just focus on just that spot. We want to rehabilitate all the associated structures, so including the posterior structure, the structures at the back, which is the calf muscle, and even the quadriceps and the hamstring. So the whole complex needs to be rehabilitated. So let's do a very simple calf stretch by having the toes on the block and the heel down. Okay, and then with the knees straight, tilt slightly forward to increase the tension. Maybe you can bend the other leg a little bit if you want to. You can vary the angle of the knees until you feel the stretch in your calf muscle. Yeah. Oh, good. Now, if obviously it's too low, then you put a higher block or use a step in the house to achieve the same thing. Yeah. Let's continue the stretching now, Sophie, of the back of the legs using the classic wall stretch, whereby you're holding onto the wall, putting one leg further back, and keeping the heel as firmly down as possible. So let's do that. Excellent. And if you bend the front knee a bit more and tilt forward, you should increase the tension, hopefully, on the back leg, keeping your leg straight and keeping your back straight as well. So we are tilting forward. And try not to overextend your lumbar spine in case you have a problem there or sensitivity. Yeah? Just the whole body comes in a straight line, bending the front leg, keeping the back leg completely straight, keeping the heel firmly on the floor. And just do a few repeats of that. Great. Thank you. Now, let's focus our stretch on the tibialis anterior muscle. And it's not an easy muscle to stretch. But one of the ways to achieve that is by putting pressure on different parts of the muscle using one of these rollers. There are various rollers out there. Some of them are softer, some of them are harder. This one is called ridges. It may be a bit uncomfortable, so I would suggest you start with a smooth polystyrene kind of roller until you get used to it. So let's try this one anyway. But if it's very tender, we can put a towel on top of it. So you're going to actually kneel on the roller, and we're going to do some movements up and down to try and release the tibialis muscle. Good. How is that? How is your comfort level? It's a little bit. Okay, now the idea is not to make big sweeps up and down the whole leg, but stay in one small area, go backwards and forwards to release that part, and then move it further down and then further down as you progress. Now, if this is tender, as I said, let's try with a towel maybe and see if it's any better for you. Try that. Otherwise, you may not forgive me. How is that?
It is a lot better.
It's better, yeah. You achieve the same results, basically. Obviously, if it's in the inflammatory stage, you may not want to do this because it's too painful. You have to wait until it subsides. Thank you. So here we're going to use a roller again to stretch this time the calf muscle, not by rolling it up and down, but by moving the foot, plantar flexion, dorsiflexion, whilst the pressure is sustained on the roller. So let's have you one leg on the roller. Okay. Now, make sure you put a bit of pressure as well on the roller, and in slow motion, point your toes towards your face, and then slowly point them away. Do maybe 5 repetitions on that particular spot, and then afterwards move it a little bit further out, and then do it at another position, and then progress yourself further upwards. You may want to put additional pressure if you want with that foot on top of your leg there, just to give it a little bit more weight. Yeah. There is a bit of a caution to this. If a particular patient has problems with their circulation system, if they have any blood clots, any history of DVT or deep vein thrombosis, maybe you shouldn't be doing this activity. Yeah. Obviously, check all the exercises with your specialist before you do them. Lovely. Thank you. The next one, Sophie, you're going to use this roller. There are various types are on the market. There are some narrower ones, harder ones, and you're going to basically massage the tibialis muscle by rolling it up and down. So have a seat on the floor, make yourself stable, cross your leg maybe to expose the top. That's fantastic. And put pressure in a small area, work on it. Maybe do 5 repetitions in one spot and then move it up. Obviously, if you had shin splints, that would be a little bit uncomfortable. But it does help to improve the function of that muscle, improves the circulation. It stretches the fibers as well. Yeah, and continue all the way up. Thank you. Sophie, we're now moving on to the more engaging, strengthening exercises. I think what we've been doing so far is actually loosening up, stretching the area. Now, this is a nice, simple exercise you can do on a chair using an elastic band to exercise your quadriceps by extending the foot forward. So the way to do it is get a nice, steady chair, put the elastic band around the foot, and then put your foot in there. Okay, sometimes these elastic bands, they can slip. Try and keep it in one position, then put it a bit lower down. Okay, in a slow, controlled fashion, try and extend your knee. Not fully up to there. Never fully extend because you're locking it. When you come to the extension, pause it, count to 2 or 3, and then controlled fashion back down. And again. Which muscle are you using now? Which muscle are you engaging? Your quads. Fantastic. Okay, good. The other variation to that, if you don't have a foot to engage the tape, is to put it around the other foot. So one of them moves forward, the other moves slightly backwards. Yeah, so it should sit a bit more towards the edge of the chair. So you're actually doing both legs. One is flexing, so you're using the flexors. The other is extending. You're using the extensors. 2 for the price of 1. Yeah. So you can do just one on its own, or you can do both together. One moves forwards, the other moves backwards. And once more. Great. Thank you. Sophie, again, we'll use the tape this time, looped around one of the foot, and you're going to do a very subtle move, which is basically eversion. It's basically rolling your ankle outwards. So you're engaging some of the peroneus muscle there. So let's have you sit in. Put your foot in this one, towards the end of the foot, and that one you step on it. Yeah, so you step on that end and have the tape towards the outside bit. So I want you to rotate the foot. I want you to twist the foot outwards. That's it. Hold on to that and then relax. Keep the degree of tension on the tape. That's it. And relax. Let it go all the way back to neutral. That's it. And then outwards. It's a very small movement, very subtle movement. Don't expect to see huge movement. But nevertheless, you are engaged in those muscles. Yeah? Mm-hmm. Good, thank you. The next exercise, Sophie, is doing the clumps with your thighs, but under the resistance of a band, yeah? So lie on the floor for me on your side. Loop this around your thighs. Now, I'm not sure if it's the right tensile strength. If it's too tight, then obviously get a softer one, but let's try. Okay, feet together, push your feet together for stability, and then splay your knees outwards, pause to 3, and then gradually allow it to recoil. And then again, good. Take a nice deep breaths. People tend to forget that they need to breathe well when they're doing exercises. People tend to hold their breaths, but we need to have good oxygenation. So nice breathing and slowly back down. Where do you feel the muscles engage in which part of your body? Yeah, all along there, which is basically your abductor muscles, your glutes, and your tensorofascial lata as well. Excellent, thank you. The next ones is a series again of small movements with your feet, doing inversions, eversions, or pronations, supinations, just to engage those fine muscles that work on the ankle and obviously work, which are attached on your lower leg. So we need to exercise them if we're going to rehabilitate the whole of the lower leg, the shin splints and tibialis muscle. Now, put the tape around one of the feet and good. With this exercise, you put it on your forefoot, and as you pull the tape towards you, you point your toes away and hold it, and then relax. Relax the tape a bit. Then as you pull the tape towards you, you increase the tension by plantar flexing. And again, that's actually now exercising your calf muscle, of course, yeah? Engaging the calf muscle, good. The next one, Sophie, it involves a bit of dorsiflexion and eversion again. This time you're going to have the tape around your foot like that, and then hook it around the other one, and then pull it with your hand. Give the tape a little bit more slack so that you have a bit more give. That's it. And rotate this foot outwards and upwards. Hold on to it, and then relax it. Looks like the tape is a bit, the band is a little bit too hard. Maybe you need a more flexible band for this, I would think. So rotate, dorsiflex. Good. The next one involves resisted dorsiflexion. So you're going to dorsiflex or point your toes towards yourself, but the tape will be in the other direction. I'm going to hold it like this, and I'm going to ask you to point your toes slowly, point your toes up, hold it, count to 3 maybe, and slow motion, relax it, but don't relax it fully because you're going to lose the band. So pull up, hold it, and then back down. So this is one of the most important ones because for dorsiflexion, we are engaging what? Your tibialis anterior muscle, which is the one that is involved in shin splints here. So that you start gently and you build up gradually. Yeah. So have the band attached to a furniture, a steady chair, a sofa, a handle, and do that. Yeah. The next one is going to involve, again, a subtle movement with your ankles this time, not the eversion, not the outward movement, but the inward movement, the inversion or the supination, as we call it. So loop the band around the foot again, and you may cross them over like that for ease. You can hold it from here. Okay, so you're going to attempt to twist your foot inwards against the resistance of the band, yeah? And then relax it. And then again. Maybe we can show it without the crossing over of the leg to see if it comes across better. So you want to attach the tape pull the tape in this direction as much as possible and twist the foot inwards and then straight. Again, not a lot of movement, but nevertheless, we are actually training that part of the foot. Thank you. The last one in this series of exercises, so it involves you lying down again, hooking the tape around your foot, facing up, and then twisting the whole pelvis and the leg to the opposite side whilst you're maintaining the tension on the leg that is elevated. So it might be easier to explain when you're down. Take the tape. Okay, let's do it on that leg and rotate this way. Good, so lie flat down. Keep the leg not all the way up, a little bit further down, about 45 degrees. That's fine. Keep the tension on the band, and in a slow motion, allow the leg to drop to the opposite side, never horizontally, but keep an angle like that, about 45 degrees. Maintain the tension. We are stretching the calf muscle, the hamstrings, also part of the glutes as well. Yeah, and then in control fashion, go back to the neutral. Again, pull the band towards you, increase the tension, and slow motion rotate away to the opposite side. Hold it, count to 3, and then back to the neutral position. Conditions that may present similar to shin splints: chronic exertional compartment syndrome, stress fracture, tendinitis, bone tumor, peripheral arterial disease, and pain referred from the spine. Causes of shin splints: a rapid increase in leg activities, especially running, dancing, and jumping, inadequate stretching, worn out or bad running trainers, flat feet, muscle imbalance or weakness, poor running technique, i.e. overstriding, and running or jumping on hard surfaces. Shin splints additional therapeutics: topical anti-inflammatory gels, compression stocking or running socks, fish oils, glucosamine, Epsom baths or topical spray, and cooling sprays. Please note that the evidence may not be backed up by research.